Good morning from the Evening Standard in London. The United Kingdom should be more or less free of the coronavirus crisis by the end of the year, a leading epidemiologist has predicted. Professor John Edmunds, a member of the government's Scientific Advisory Group for Emergencies, or SAGE, said some measures would remain probably forever. But he told ITV's Peston, "I think we will more or less be free of this by the end of the year, say Christmas." His comments came as he warned against relaxing lockdown restrictions too quickly and said there was a need to be very cautious about foreign travel. The Housing Secretary has defended his heavily criticised plan to make leaseholders pay to strip unsafe cladding from buildings. Robert Jenrick has insisted that it is fair that low-rise leaseholders face bills of up to £50 per month for the removal of unsafe materials. He said it was a pretty affordable amount of money, which would mark a huge step forward for people who would otherwise be very, very worried that they are going to have massive unmanageable costs. Jenrick unveiled a £3.5 billion package yesterday, which he said would mean no leaseholders in high-rise blocks in England will face charges for the removal of unsafe cladding. Former Health Secretary Jeremy Hunt has admitted that the UK prepared for the wrong pandemic during his tenure by believing the next biggest threat would come from the flu. Hunt, who chairs the Commons Health and Social Care Committee, said decisions he made while in office could have affected Britain's ability to respond to the COVID-19 pandemic. Asked about current mistakes, he said, "We've really been on the back foot from the start on test and trace, and in some ways it dates back to the period when I was Health Secretary. A new drug for treating obesity, which could cut body weight by up to 20%, has been described as a game changer by researchers. More than 1/3, that's 35% of people who took a new drug for treating the condition, lost at least 1/5 of their total body weight, according to a global study involving University College London researchers. Findings are being hailed for their potential to improve the health of people with obesity. Experts suggest they could also play a major part in helping the UK to reduce the impact of diseases such as COVID-19. And finally, the Duchess of Cambridge has praised a group of student nurses soon to join the profession, telling them they were needed now more than ever. Kate and William chatted to the trainees during a practical lesson, and the Duke sympathised with the group who took part in hospital placements during the coronavirus pandemic, saying that's really a baptism by fire. At the start of the first lockdown, the students from Ulster University's School of Nursing joined the frontline fight against COVID-19, working on wards or in the community.